Hey everybody, I think there's about 10 of us in here so far, so I was going to give it a couple minutes before I really get started. So the chat is working and the Q&A section is working, so as we go I'll probably address most of the questions at the end just to not get overwhelmed if there's so many questions, but I'll try to be pretty thorough, but I will answer all your questions at the end. Let me see how many people are here and then we'll get started. It looks like a few more are joining. So let's just give it a couple minutes. I'm trying to see who's in here. Hi, everybody. I know a few of these names and I've seen a couple of you in the office. So thank you for coming. We're excited. I'm gonna have this probably go for around a half an hour. Feel free to come and go as you like, but I hope I'm interesting enough to stay. What time is it? It is right at noon, so let's get started. And again, if you have any questions, the chat and the Q&A is working. I do have the chat up already on my screen, so just to keep it streamlined, if we could just go into the chat, that way I don't miss anybody's questions. All right, so a little bit about me for people who don't know who I am. I am Brooks Pittman. I am the nurse practitioner here at Contoura in Ponte. I think most of you are from the area, but just in case there's anybody from out of town. I am by trade a family nurse practitioner. I've been with this practice for almost 4 years. All of my experience outside of my family practice grad school program has been in aesthetics, and I did some residencies in aesthetics as well, knowing this is kind of what I wanted to do when I grew up. But my background actually is in pediatric intensive care. So took a pretty good 180, but I really love aesthetics and I really love what I do. So I hope I can bring a lot of knowledge to the table. So Contoura Facial Practice, we are here. Huge facial plastic surgery practice in Ponte Vedra. So we see a lot of patients every day. All I do is this non-surgical practice. I do know the surgical practice that Dr. Garcia does, so I can speak to it a little bit, but my specialty really lies in non-surgical. So I spend all my time researching and doing trainings and helping people figure out if non-surgical options are the best. So I do have a lot to offer and I really enjoy what I do. So I'm pretty proud of my practice and I hope to see you all soon. So here we go. Maybe here we go. There we go. Okay, the aging face. I tell everybody, or I start all my consults like this, so we can really know how the face ages. That way when I offer suggestions of how I'm gonna approach your plan of care and our treatments, I think of this graph pretty much exclusively when I'm looking at everyone. We age in 3 ways. We age with our skin quality, and I'll go over each of these individually, but just for simplicity to begin with, skin, volume, gravity. I think of it as a triangle because that is the shape we're going to try to accomplish, an upside down triangle. So our skin, volume, gravity are all the components of how we age. When we're looking at treatments, we can't replace one part of this triangle with another part of the triangle. So when I'm evaluating somebody, I look at these 3 things and see, hey, which is the primary problem here, secondary problem, tertiary problem, and I try to address the one that's bothering my patient and the one that is the main issue first, and then complement it with the other parts of this triangle. So first things first, our skin. We obviously age with our skin. We have free radicals, we have environmental issues, we have sun damage, all the chemicals we put on our skin. Just the aging face in general allows dark spots to be seen that are underneath in the dermis. We have a reduction in collagen, reduction in elastin. Our skin gets thinner, showing more fine lines and wrinkles. We have drier skin. The moisture escapes our skin as it gets thinner and it has a compromised elasticity. Our moisture escapes, so we have a drier look to our skin in general. So we age with our skin. So common complaints that I hear. Wrinkled or sun damaged skin. Obviously we preach sunscreen. We preach sunscreen every day. We get damaged skin from the sun, but people don't often know that we also get damaged skin from rays that come off our phones, rays that come from the lights that we sit under, our computer screens for those people who don't put sunscreen on before they get into the office. You're just damaging your skin just sitting in front of your computer all day. So there's a lot of medical grade sunscreen that actually has that technology in it to protect our skin from those rays. That's why we preach sunscreen every day. And I think we often fall short in telling our patients that the rays aren't just coming from the sun, so you feel like if it's cloudy or you're not going outside, you don't need to wear sunscreen, and that is not the truth. The truth is it needs to go on your face as part of your skincare every day, or you're going to get this damaged skin. Age spots or skin discoloration, just from free radical, it's just thinning of skin. We're damaging our skin throughout our lives. Most of our sun damage, actually I think 75% of our sun damage happens before the age of 18, and this damage starts showing at an older age, even though the damage already happened. So I don't know about you, but I have a 4-year-old and I lather her face with sunscreen every single day, knowing that it's my job to protect that part of her body from a very, very young age, so she doesn't have to deal with this when she's 35 like myself. I used to sunbathe on top of my mom's roof on the shingles, so I have a lot of catching up to do. Animation lines. We get fine lines and wrinkles just from smiling, frowning, squinting. We're from Florida, so sunglasses, if we're not wearing them, we're squinting constantly, causing these furrow lines, forehead lines, animation lines. There are some animation lines in the lower face as well, and that's where Botox comes in. Deep furrows or folds from your squinting, and acne scars. So that's a really tough one, but that is a very common complaint. This graph I have over here kind of just shows younger skin versus older skin, and how we lose all this elasticity. You can see what a tight elastin and collagen production we have in that younger skin. But when we get to this older skin, it's disrupted and it's not as much elastin, and it's very depleted. So that's why we don't have that snap back. We don't have that fibrous network. We don't have the tight skin on top, and that's what the moisture tends to lose. Our wrinkling starts to happen. The melanocytes start to overproduce and underproduce, and that's where we see age spots and hypopigmentation, or those white spots all over your skin, just an uneven, not as effective working skin system. What we do in this office for skin rejuvenation, we can tackle that in a bunch of different ways. Any time we're addressing the skin, we have one goal, and that is to get your tone back, your texture back, and the elasticity as much as we can. So we're always trying to stimulate collagen. We're always trying to take off that top layer of damage, and really make your skin healthy from the cellular makeup up. So skincare in general is a marathon, not a sprint, because we are working at that cellular level. So we try to tell our patients, hey, you're gonna have to stick with us with your skin treatments, with the exception of Botox. Obviously that works in about 5 to 7 days. So that's a sprint of a treatment, and that's why patients love it, because it's almost instant results. But anytime we're resurfacing or lasering or our chemical peels, you might see some good results on the top of your skin in the first week or so, and then you might not feel like it's working. We get a lot of complaints, it's not working. Our skin cell turnover is about on an 8 to 12 week cycle. So when we're working down in the bottom of our cellular network of our skin, we're not even seeing the results of some of these things with these collagen production treatments until that 8 to 12 weeks. So you really have to hang in there with your microneedling, with your laser resurfacing, with your chemical peels, and know that these results are coming in the future. And routine skincare, routine facials, routine microneedling, it's going to keep that collagen awake. It's going to keep your skin looking young, and you might not see this huge, enormous change right off the bat, or you might not see this huge, enormous change over a year or so. But if you've been doing these treatments for years and have a really good routine, when you're standing to somebody next to you, it's the same age, and you've been doing these treatments for 5 to 6 years, and they have not, you're going to stand out from the pack. And that's what I try to tell my patients. Like, this is a long-term benefit of skin. This is how we keep our skin healthy. If you don't do one other injection, I think that skincare is where everyone should start. This is where everyone should pay attention to very early in age. And once you're older, it's not too late for you. It might take a little longer to get these same results, but we really can get your skin looking younger if you really have the patience and really trust us with your skin. I think Destin's going to have a webinar coming up as well. And she knows the skin better than any esthetician I've ever met. She's our medical esthetician, lead esthetician here at Contoura. She's going to do a webinar, and she can really dissect some of these treatments down for you. But I'll show you some before and afters of some of these treatments that people that have really just stayed on our program. So Botox, fine lines and wrinkles, anything animation, skin resurfacing, microneedling, lasers, chemical peels. We're trying to wake up the collagen. We're trying to even the tone. Those are your aggressive treatments. Those are things we put you on 4 to 6 treatments in a year or so, and then get some results. And then we put you on the routine monthly facials and skincare once you go through like that boot camp for your skin. And then Botox, that never goes away, guys. How often you have to do it depends on how fast you metabolize it. It depends on what goal you're looking for. You're just looking for every 6-month refresher, but Botox lasts about 3 to 4 months. So if you really want your skin to stay still and not to make those creases in those animation lines, and you don't want to create that wrinkle, if you can't make a wrinkle, you won't make a wrinkle. It's kind of how I tell people. I'm like, if you can't make it, it's not going to be there. So if you really want the results, that's something you do have to put in to your routine every 3 to 4 months, just like you have to color your hair or trim it. That is just one of those treatments that doesn't matter what surgery you have. It doesn't matter how much volume you have in your face. Again, the triangle, skin, you can't replace it with volume. You can't replace it with surgery. Botox is just something that's going to be there. This is an example of somebody, she has fantastic results. She came to us with a ton of, and any pictures I show in here, by the way, we have consent from these patients to show these pictures. So don't think when you come into our office and we take your pictures in our blue room that we're just going to put you on a slideshow unless we ask you. So she has given us consent. She came in with lots of sun damage, lots of fine lines and wrinkles, lowered brows. She had complaints about wrinkles around her mouth. She had complaints just overall skin texture. She did a large chemical peel, a TCA. Then she did a microneedling package with Dustin. And I've done some Botox on her as well. And you can, I think these are the pictures were taken about 6 months apart. She is thrilled with her results. You can see she has much more of a glow to her skin. She has much less sun damage. She's even gone further than this after picture, but this was her 6 months apart. The fine lines around her mouth are much improved. They were pretty severe, so they're not completely disappeared, but you can see how she would be totally happy with this. I raised her brows a little bit with Botox. And just an overall glowier, healthier. You can see there's more thickness to her dermis. You can see that there's health to her skin that did not exist prior. She stays with us. We see her every couple months because she is definitely still staying in her routine trying to get better results. All right, gravity. Gravity is the other part of the triangle. So again, we're doing skin, now we have to address gravitational changes. Gravity is obviously always pulling on our bodies and face, on everything. It's always pulling down. It's not our friend. It's going to win eventually, but we definitely can find it. The effects are most noticeable when the skin's elasticity has declined drastically. And for most, and I'm going to show a chart later that shows you the collagen production and elastin and how hormonal effects have it drastically decreases in the 40s and 50s. So most people start to see the early signs of aging, maybe in the late 30s to early 40s, depending on how well you've taken care of your skin or genetics even, and really in the 50s. You'll start to notice jowling, marionette lines, which is that line that comes down from the mouth to the chin. Loss of your jawline. You'll see flatness in the cheek from gravity, but most patients that come in complaining about this lower face area, the lower face is everything that's dropping from the top to the bottom. Think of your face as a waterfall. So whatever is happening up and out is falling in and down. So if you're sitting in my chair and you're like, this is bothering me, don't be surprised if I'm pointing up here and be like, I know this is bothering you and we'll get to that, but hey, we need to address up so I don't add volume or start boxing you out trying to address all down here. This isn't the problem. The problem is it's coming from up here and it's falling. Not just a funny meme. Oh, that's funny. So gravitational changes, this is what I just talked about. You can see her nasolabial folds. These are the smile lines, people call them, like from the nose to the mouth. Again, her cheek is dropping down. Gravity is taking it downward, causing a fold. Gravity is taking it downward, causing this fold. This isn't directly that I need to add filler or anything here. It's falling. So we need to pull up and give that face its shape back. I probably should have added the triangle slide here, but we'll see it in a minute. Your face is supposed to be an upside down triangle, like this. All your volume up top narrows down to the chin. We call that the heart shape, so volume, volume, narrow. That is the signature of youth. So anything I do to your face is to recreate that shape, and it is not to box you out here. You can see she's wider at the bottom than she is the top, or even she's kind of square, and that is an aging face. So everything we do for her is going to be lifting up these jowls, lifting up these cheeks, concentrating on that upper face in order to contour down on the bottom face, the lower face. 2 ways to go about gravity. Kind of 3 ways, but I'll get to that. You can add volume to lift up, but it's going to be so much volume it starts to look unnatural. So if your main issue is gravitational pull, and I don't see that adding volume to your upper face is going to help lift the lower face, I'm going to talk to you about gravitational procedures. Non-surgically, we have thread lifts. Surgically, we have a facelift. Thread lifts are exactly what they sound like. They are a PDO thread. So these are deep sutures. So that back in cardiac surgery days, anybody that I have that's medical on here, they put PDO sutures for deep cardiac closures. Well, they noticed that when they were doing that, they were building collagen in those areas that they were suturing these patients. So the cosmetic world just kind of grabbed onto that and started doing it aesthetically. So we take these sutures that have some barbs. I have different lengths. I have different barb directions. I have kind of a whole toolbox of threads I can use, and we put them in the face to lift up on that tissue in different directions to try to get those gravitational and those jowls and that jaw up. Half of our results on thread lifts are coming from the collagen production that happens over the next few months. So you cause any micro injury to the skin, the healing factors of our skin that come to play when we're trying to heal something, or hyaluronic acid, elastin, collagen. If you think of those words, that's everything that's in our skincare. That's what we're trying to call for youth. So we're like, let's micro injure the skin. Let's get all these youthful, helpful parts of our body to the same place, and we get this youthful glow and this collagen structure that lifts. So not a lot of downtime. I do it in the office. It takes about an hour. Pretty comfortable, and there's some pressure. If you've ever had a filler, it kind of feels like if I filled you with a cannula, just like a pressury kind of feeling, but most patients are very comfortable. Not a lot of bruising, a little bit of tightness. I like to reserve this for the early signs of aging. So think of those 40s, some 50-year-olds that can still produce collagen in. It's kind of hard to produce collagen once we get into those 60s because you're so depleted that stimulating collagen is hard. I will be very honest with you if you're in my office and in my chair. If I think that thread lifts are going to make you happy, I will do it in a heartbeat. If I feel like maybe you're more of a surgical lift patient, I will tell you. So never feel like you're going to be anywhere in a consult with me and I'm going to mislead you whether this is your treatment or not. Great treatment though if you're in these early signs of aging and you have collagen to stimulate and you have not a lot of heavy tissue. I can use it in the neck, I can use it in the face, I can lift brows, I can do smile lines, I can use threads in a lot of different ways, and I love to use threads in combination with filler because then I can get a really good lift and I can volumize as well. That brings me to liquid facelift. That is using filler. So I'm adding volume again from the top to the bottom. I'm beginning in the upper face and I'm working myself down. So I'm lifting, 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 and finally ending in the jaw. This usually takes for most people around 6 or 7 syringes of filler, which seems crazy to people that haven't had filler before. But let's remember, filler comes in 1 ml syringes. It's 1/5 of a teaspoon, and 7 syringes of filler really looks very natural in a face if done correctly. It wouldn't be in the same spot. So that is what's considered a liquid facelift. Here's the triangle I was talking about. So volume. We flip as we age. We used to be this upside down triangle. We start to box out until we become a regular triangle. And that is why I start filling at the top of the face as to not box you out. Because if I add filler down here just to take away lines, I just make you look older. The line might be gone, but you're not going to look younger. You're just going to look like the line is gone. And that isn't the aesthetic we're going for. Volume loss. This is a 35-year-old, 45-year-old, 55-year-old. In the 35-year-old, which I would have to disagree, I'm 35 and I don't feel like my fat pads are that intact, but the 35-year-old has fat pads that are very cohesive. They're in the right places. You can see it's holding structure to the face. As we start to age, they start to dissolve. They're under hormonal control. A lot of it is under hormonal control. So we start to dissolve these fat pads, which causes the tissue on top to fall. Think of these fat pads in your bone structure as the tent poles behind your skin. So if you're collapsing the tent poles, what is the skin or the tent going to go around it? It's just going to collapse and fall. And that's what happens starting in our 40s and 50s. We start to fall and really see it in the lower face. Here is the volume of the face. You can see estrogen per fat volume. Look what a huge downward tank it takes between your 40s and your 50s. Starts in your 30s, you start to go down. So I start to see a lot of patients in this 35 to 40 range. But when people get from 40s to 50s, the volume goes drastically down. So as you can see, we have to be able to add a pretty decent amount of volume by your 50s in order to accomplish volume replacement. Rule of thumb I use is you're about 1 syringe per decade of life for volume replacement. So someone comes in their 30s, I'm probably using around 3 syringes of filler to correct their volume loss. 40s, 4, and all of this has to also do with how well you've aged, and that can be genetically, it can determine on genetics, it can be the way you've taken care of your skin, lifestyle choices, all of this comes into play with how well you've maintained volume. So smokers or people who drink a lot, they're going to lose volume faster, and that doesn't mean that we can't volume replace it. It just might be, I need to be a little bit more aggressive. So just 1 per decade is a starting point. It's just kind of a ballpark figure just to give somebody an idea of what they might be looking at for volume replacement. Common areas that I treat with volume replacement. Temples, that's a place that a lot of people forget about, but especially women. I know I have a few guys on here, but especially women, we lose a lot of volume in our temples, and it collapses in here, makes our brow drop a little bit, and it makes us look older. So when I look at a face to volumize, a lot of times I'll start here in the temples, and people are very surprised that I recommend that, but it really makes a huge difference if we can get volume replaced there first. Flatten cheeks. Probably my #1 filler that I do in the office for volume replacement. I mean, I do a lot of lips and aesthetic stuff, but I think that for anti-aging treatments, flatten cheeks is one of the first things I do, one of the most natural fillers you can get, which is a common misconception. I think Hollywood has just really ruined us on cheek filler because you have some overfilled people. But if you do it correctly, it should just be a contour and a lifting of the upper face. The tear trough, that is this fat pad that's underneath your eye, and people start to see dark circles and some hollowing. The cheeks and the tear trough, guys, those are a married couple. I can't go in and start filling tear troughs without addressing the cheek, because if you have a flat cheek and I fill your tear trough, I'm going to make you look flat. So think of these 2 areas as one, and I will make sure that your cheeks look volumized before I add to your tear trough, so I don't make you look older or odd or flat-faced. Nasolabial folds, marionette lines. Some people can go straight there and we can fill straight in here, but a lot of people, again, I will lift up that cheek and then I will fill in here just to give you a very natural look. A receding chin. Profile, you're supposed to have that projected chin. There's certain measurements and certain angles that are ideal, and that's when you're sitting in my chair, we can go over that. It's a little hard over FaceTime, but jawline and chin, the chin starts to recede. You'll start to see this little fat pocket sometimes under your neck, just because your chin needs to be protruded, and it helps define the jawline. So the chin is a very common filler. Fullness in the jawline, I can fill in the jawline as well. Very popular filler, takes a pretty good amount of volume, but looks really pretty if I can chisel it. And then loss of fullness in lips and pronounced lip lines. The vertical lip lines they bother every female. I use a combination of Botox and lip filler. I don't always fill just into the top lines of the lip. A lot of times I will fill, most of the time I'll fill in the lip, which scares a lot of people, but I'm not trying to create a ducky overfilled look. I'm actually trying to fill in the border to unshadow and give the tent poles of your mouth area back to distract from those upper lip lines and to calm them. They're really hard, but if you're open to lip filler and not looking too volumized, it is a really, really pretty way to make the mouth area look younger. So how do I replace volume? I have a lot of different fillers. Juvederm and Restylane are hyaluronic acid fillers. They are probably the most common fillers. That's your Restylane, Juvederm family. I have, they each have their own portfolio of fillers. So I handpick depending on what we're trying to replace, whether it's something I need a thick filler for like a cheek or something I need a very thin natural filler for like the lips. I have a whole bunch of options in the hyaluronic acid. Those are reversible fillers. They last anywhere from 9 months to 2 years. Actually, Voluma has indication for 2 years. So anywhere from about 9 months to 2 years on our hyaluronic acid fillers, probably what I use the most of. Bellafill is a filler we just brought into this practice. It's not a new filler, but we just started using it. That is in the biostimulator family as well as Sculptra, so I'll kind of talk about those at the same time. Bellafill comes in a kit. It is a 5-year filler. It stimulates your own collagen, so it's one of those marathon, not a sprint kind of fillers. You get filled, and in about 3 months you see your final results. It stimulates type 1 collagen over those 3 months, and then it lasts for about 5 years. You do have to sit for more than one sitting in Sculptra and Bellafill. They work very similarly with different carriers. So both of those are very good options for people who have the time to volume replace and then want it to last for a long time. Financially, maybe a little bit more upfront, but then the longevity of it for somebody who's not just prepping for a wedding or prepping for an event that needs immediate results, Bellafill and Sculptra are ideal because we can get a long time out of them, and then we can just icing the top of the cake with Juvederm or Restylane in the places that we need a little bit more. Radius, I use a lot of Radius, but I use Radius a lot in the jawline. It is like our workhorse. It's a very, very thick filler and does a lot of lifting. So somebody who needs a lot of lift in that upper face, somebody who's a lot of structure in the jawline, I'll go to Radius. It comes in a little larger of a syringe, and I can use a lot of it to do some serious lifting. Here's a liquid facelift patient. These pictures were taken about 6 weeks apart, I believe, and I've done a couple other things to her since, but she has 7 syringes of filler in her. She came to me complaining that she didn't like looking at herself. She felt like she just looked old. Such a sweet lady. We ended up filling underneath her eyes and in her cheeks. Didn't do much to her folds. It looks like we did, but I lifted a lot in her cheek area and did a lot of volume replacement in the eye area. And then I did a lot to the jaw and the chin as well. So she was a great result. I ended up actually filling in her temples later, and I think I did a little bit of nose and lip on her later, and her afters are impressive, and she is obviously thrilled, but that gives you an idea of what can happen in over a 6-week period to someone and still have 7 to 8 syringes of filler and look younger than they did before, and it doesn't look unnatural at all. So don't be scared of volume. Volume is your friend. Here's a young filler patient. People always laugh when I think 30-year-olds are getting filler, but she had a tear trough and her cheeks were going flat. So we just did a little bit of cheek filler to contour that cheekbone, and I did some filler underneath the eyes, and this was same day results. So not a lot of downtime on cheek filler, but you can see how much a difference it made in her folds by her nose and under her eyes. It woke up her face. And even in the jawline, if you can look closely, her jawline lifted up, and the heaviness in this lower face right here lifted just by adding contour to her cheek. Because again, our volume falls down and in. So by picking up this cheekbone, she's gotten some benefit right here in the jowline. This is a thread lift patient. This is the subtlety of the same day, but if you look at her jawline and you look at her nasolabial folds and her marionette lines, again, thread lifts, main results are 3 months later. So if I took a picture of her now, she would even have better results, but this did a pretty good lift in this cheek area right here. If you look at her profile, like in this area, and if you notice her marionette line is from her lip down to her chin almost on the before, but the after, it's picked up where it only has a couple centimeters of drop there by her marionette line, and her jawline is much more chiseled. So that is, she's in her 40s, early 40s, just early signs of aging, and she got a really great lift from threads. Okay, Kybella. Kybella is a permanent fat dissolver for mostly the under chin area. It can be kind of used wherever there's fat. So speaking face-wise, since I do mostly face, I use it a lot in this jaw, under the chin area. It takes multiple treatments. Deoxycholic acid is what our body uses to digest fat in our stomachs. It was synthesized, put in a vial. We put it into the area to be treated, and it dissolves over about 8 weeks, those fat pockets, permanently. So not a lot of downtime. There is about a week of downtime, so minimal downtime is what I'm going to say. You do double chin, hence my little meme over there. You look like a turkey neck for a week or so, so plan for that. It takes multiple treatments, but once it's done, you never have to do it again. Those fat pockets are gone, those fat cells are dissolved permanently, and you never have to deal with it. I do this underneath the chin and around the neck before I'll do jawline filler on a lot of people that have a heavy neck. So these heavy fat pockets, it won't work on people who have saggy skin if they don't have a fat pocket, but will work on the heavy double chin that bothers people. And this oftentimes has nothing to do with weight. This is this fat is genetic. The tiniest little skinny people can still have that turkey neck that they can't get rid of, and that is when I love Kybella to chisel. Before and after, young girl, she had a very heavy neck. She actually sat for another sitting after this one, but this was 2 treatments of Kybella. I didn't do any filler on her, no jawline filler, nothing else, no chin filler, just I did 2 vials of Kybella, and then 8 weeks later I did 2 more, and then 8 weeks later this was her result. She was very happy. We did another one since then, and I never saw her back after that, so she didn't come back for her final, but she was super thrilled. Okay, so take-home points. There's different components to the aging process. There's skin, volume, gravity, and we have to address each part of the triangle if you want a full treatment. So if you want the anti-aging process to work, you have to go, my lights went off, I don't know why. You have to go addressing all of them, and skin is the one you gotta stick with the most. We have to approach all aspects. We have to approach surface issues, gravity issues, and volume issues. And if you are open to addressing all of those, we can make great results using just non-surgical approaches. If you are a surgical candidate, I will be the first one to tell you that I would love to help you, but going to Dr. Garcia first might be a good idea, and I will be so honest with you on that. Okay, so now people can ask me questions. Thanks for listening to me, but I will answer anything if people want to go into the chat. I'll actually pull up the Q&A too to make sure I can see everyone, but a question away. There's my contact information too, so if you think of a question later that I didn't get to, you can email or just call, that's the office phone, and they can connect me to you, or they can also, we have great front desk people that can answer questions. So, all right, I'm just gonna wait for questions. I can probably continue to talk because I can listen to myself talk all day, but I'd rather not. Oh, I got one. If I can get my Q&A one, I got one. What are the costs of the different treatments? Okay, so cost, that varies. Botox we start at $12 a unit. Average number of units for Botox is, if I want to average it out, it's hard to tell without seeing you, but right in here, 15 to 20. Forehead is anywhere from 5 to 10 to 15 usually, and around the crow's feet is somewhere between 15 to 20 for both sides. So I'd say my average Botox patient has somewhere between 30 to 50 units, unless you just have little tiny areas. So that's Botox. My fillers range anywhere from $500 to $900. Different syringes cost different amount of money. Sculptra, 800-ish. So everything is a little bit different. A good way to save on a lot of these fillers is once I get you on a program, I'll try to stay into a rewards program. So Galderma has their rewards program. Juvederm Allergan with Botox and Juvederm has their rewards program. So I always make sure to sign you up for everything. That way I can cherry pick what I want and get coupons back to make it more affordable every time you come in. And then we run specials every month. So if you follow our Facebook page or just get our email blast, there's always a special out there every single month. And I'm very mindful of people's pocketbooks. So I try to tailor a treatment to you to be in your comfort level and my comfort level, and then we can space it out to make it very easy for you. Breastfeeding breastfeeding, unfortunately, we can't do a lot with Botox and fillers till you're done breastfeeding. But skincare, we can do a lot with lasers and skincare. So if we want to get you into the skincare program, Destin is actually pregnant, our esthetician. So she's really into breastfeeding and pregnancy safe products right now. Unfortunately, I cannot do Botox and fillers on you, but we can get you on some collagen stimulation, some growth factors, some really good skincare, some really good lasers. Because I know when you're breastfeeding, you'd feel like you just want a refresher and that year won't go by fast enough. But there's options. It's just not Botox and fillers. How do you address acne depressions on the cheeks? Acne depressions on the cheeks, we have a couple different options. Those are tough, and I'm really sorry that you're dealing with that because I know how frustrating that is. I have been that person. And it's a really, really discouraging thing to treat. It does take a while, so we'll have to ask for some patience on treating your acne scars, but Bellafill is FDA approved for acne on the cheeks. We go in, we can dissect each one of those acne scars and lay a little bit of product below it, and it's a good way to stimulate collagen, and it is a 5-year improvement. I will say, even after we do the Bellafill, we still have you do a microneedling package depending on how bad that acne scar is. If the acne scars aren't boxcar, let me rephrase. If the acne scars aren't boxcar scars and they're not super deep, I won't push you to Bellafill. I would put you on a microneedling package first to see if we get improvement in that. But you're looking at 6 to 9 treatments of microneedling about a month apart. But we have great results. We do have PRP in the office, platelet-rich plasma, which is the workhorse of collagen stimulation. So a lot of my acne patients, I will say, let's do some microneedling with PRP because we can really get some collagen stimulation and get down to the bottom. Sometimes those acne scars need to be dissected if they're too deep, and that's when I go to Bellafill. A little bit of downtime, a little bit of bruising, but really, really worth it for people that have been trying to deal with these acne scars for a long time. How much is face threading? Face threading starts $1,500 for the mid-face, $1,500 for the neck, and I think I'm $900 for the brows. When you package those, I usually can come up with a pretty good plan, but that's where face threading starts. Can the thread be done while breastfeeding? Yeah, actually, yeah, I can do the threading while breastfeeding. I cannot use epinephrine, so I can't use Lido with epi, but I can use regular lidocaine. All that means to you is where I go in with the thread, it might bruise. I use epinephrine to kind of taper down on the bruising, but unless your OB tells me it's okay to use epinephrine for an injection, I would prefer just to use lidocaine, and you just might bruise. But yeah, threading would be okay while you're breastfeeding. That's a good question. With microneedling, over here, hold on one second. Let me change. How long does the swelling last after lip filler? Lip filler, bank on 3 to 4 days. Really, the second day and the third day are your worst days of swelling after lip filler. And I tell everybody, I'm like, you're gonna feel ducky for a couple days, and it's not the filler, it's the swelling. It tends to swell right on the border of your upper lip, and most patients don't like that. That's what they're trying to avoid. So I call it the roller coaster of lip filler. If you can hang in for those 3 days and not panic, I promise you by day 5, you'll be happy and probably want more filler. Day 1 or 2, you're gonna wanna text me and you're gonna say, I want all of this dissolved, and I'm gonna tell you no, to hang on. Day 3 and 4, you're like, I think I kind of like it. And day 5, you'll be calling me for more filler. So, and I will also say no, but because I don't like overfilled lips. But about 3 to 4 days. With microneedling, do you typically do a full face treatment or specific areas? Full face is your best bet. We want even tone, we want even texture, and we just want an evenness to our skin. That's what looks pretty. It's even. So unless we're going after like one spot, like some people have this line right here, and I guess that they can go after one little spot, but for the most part, I would say 99.9% of the time, there's exception to every rule. Full face, we want even tone, even texture. So evenness to the skin is the epitome of beauty. So full face. What can be done for the upside down smile? Here, okay, good question. Again, if we pull up the upper face, sometimes that helps the corners of the mouth. There's also a fat pad that sits right here that dissolves. As I showed you that picture of the volume loss, it dissolves and I can put filler here. There's also a muscle that pulls down right here, guys. So as much as I put filler in there, if I don't treat it with Botox, if that muscle is strong, treating with a little Botox flips that corner of that mouth. So there's two things going on there, volume loss, muscle pull. So I will look at it and tell you if I think your muscle is pulling down. Telltale signs that you're having muscle issues, horizontal lines here, and when you pout, it's very strong. And if I start to see signs of that, I'll use Botox because that's telling me that you're making that face in your daily life. Some people just have, we all do something that's our facial expression. So if you have these horizontal lines, likely you're pulling on that muscle and I want to Botox it. How much does a microneedling treatment cost? Microneedling starts at $450 with growth factors, which I would probably never really recommend somebody doing it without growth factors. So I'm not even going to quote you lower than that, because if you're going to do it, you need growth factors on your face, because growth factors are what's helping produce collagen. $450 for growth factors. It is $800 if I'm doing it with PRP. And again, we run specials all the time, so packaging it is, we always encourage to buy a package of microneedling, because the first time you get microneedling, you're going to need 3 or 4 at least, and then we can get you on a maintenance. But marathon, not a sprint on the skin stuff, so we want you in here every month to get results. My birth control is giving me these dark spots. Birth control is giving me, oh, okay, so birth control causes melasma. So the question is, my birth control is giving me dark spots on my face. Will they go away if I switch to pills, or do I need treatment for them? Melasma comes from hormonal shifts. So when we see somebody with melasma, they typically either have been on birth control of any kind. IUDs even have some progesterone in it, so it's a less amount of hormones, but any hormonal shift can cause melasma. Pregnancy, breastfeeding, menopause really could probably cause some melasma as a shift in the estrogen levels, and IUDs. So pill, all of it could cause, to answer your question, it's not going to go away if you switch. You're still going to have hormonal issues. So risk versus benefit of birth control melasma is definitely a side effect for some people. And it is hard to go away. It's hard to treat, but it is treatable. Melasma is flared up also by heat. So if you have it and you're like, I wear sunscreen every day, but it's getting darker, it doesn't matter. If you get hot, even with sunscreen on, even under a tent, you're going to feel darker. It's heat activated. Sometimes we can get it with laser. I'll throw a fractional laser on top. Microneedling is great in combination with some skincare that has a bleaching cream in it. Hydroquinone we use on melasma with some retin-A. It takes a long time to get rid of melasma, but we see really good results with the combination of hydroquinone, retin-A, microneedling, and staying on those things and some really good sun protection. But to answer your question, will it go away if you switch birth controls? No, it's still a hormone. You're still on hormones. And then if you haven't had a kid yet, when you have a baby, just prepare for after that. After you're done breastfeeding, we have to go back to an aggressive skincare because it's likely to come back. I have seen women who have had half facelifts who end up with lots of lines under the eyes. Women, let me think. This is more of a surgical question, but again, I see all Dr. Garcia's surgical patients, so he would be the best resource for that question. I think you're talking about I'm not super familiar with the term half facelift, so it's hard because I don't know what those surgeons did. I will speak to our surgeon. He does either lower facelifts that the incisions start here, so he's not really pulling up here per se. So I would have to anticipate either they were pulled too tight or just a complication from surgery. But our lower facelifts concentrate down here. He does a lot of work with the muscle and the skin in the lower face. So I don't know if I've ever seen Dr. Garcia's patients ever have lines under their eyes. It sounds like somebody could have been pulled on a plane they shouldn't have been pulled, or had just a weird scar complication, but I'm not, that's hard for me to say. Dr. Garcia is really good at what he does, and he does really great facelifts. I have worked for other surgeons, and I can speak to his skill level, and we don't see a lot of scarring. And the great thing about going to a specialized facial plastics is this is all we do. So when there's complications, anybody who tells you that they have no complications in their practice is lying to you. But since we do it all day, every day, when complications arise, we're not surprised. You're not going to ever shock us with your complication because we've seen it 1,000 times. So we know exactly how to address it, and we'll never leave you with a complication. You will be our patient until it's gone. I hope I answered that okay, because I don't even know if I answered it right, but because I don't know what the half facelift is, but I will say if there's ever a complication, you will not leave our practice with a complication. Any more questions? I talked way longer than I thought I was going to, but I hope I covered everything. Again, I left our contact info, so feel free to call the office. I'm very available, and if our front desk can't answer it, then I'm happy to get on the phone when I have time and leave a message for me, and I'll call you back or text you or whatever you want me to do. And the email is our email to our admin, and she knows everything about this practice, so she can answer all of your questions. And then if she doesn't, she'll just ask me. Did I miss anybody's question? If not, I'm probably gonna call it a day. And you know, I wish on these Zooms I could see you guys because I feel like I'm talking to myself, but I thank you for all coming. Like, this was actually pretty fun. And I'm sure we'll do it again. And don't forget that Destin is gonna do a webinar soon, and I can't remember the date, but she'll be on our Facebook page, and she's gonna do one. And guys, she knows everything about the skin. She's great, and she knows more about the skin than I ever could imagine knowing about the skin. That's what's cool about our practice. Dr. Garcia knows ins and outs of surgery and will be the best you ever see, and Destin knows, and we have Mooney too. She's new and she's awesome, but Destin's the one that'll be doing the webinar. She knows the skin better than anybody, and I'm knocking on her door all the time when I'm stumped. And injectables, I'm the person. So if you think about the triangle I told you, skin, gravity, volume, we designed our practice that way. So Dr. Garcia is the gravity guy and volume guy, because you can do fat transfer. And then me, I'm volume and skin, and Destin skin. So we kind of model after, we practice what we preach, and we kind of stay in our lanes, and we really help each other to make sure our patients are super taken care of. But yeah, call me if you guys need anything, and thank you. Did I miss anybody's question? Does anybody? I'm sorry if I did, but I think I answered all, so I'm gonna end it, and thank you, and I hope you come see us, and hope I was at least halfway informative, and I will talk to you later.